last video on how to the treatments and drugs and stuff. I forgot one. It's often forgotten. Complementary and adjunctive therapies are the non-traditional things that people use to help treat their disorders. And that would be things like supplements, herbs, which you have to be careful with. If you're also on medications, you need to make sure your psychiatrist knows. Any herbs, supplements, other things like yoga and acupuncture. I do yoga. More for anxiety than for the mood disorder, which it does help with the anxiety. And with all the treatments comes a term that people run into called noncompliance, or a person who is non-compliant. That is someone who has seen a doctor, seen a therapist, has been given a treatment plan, and is not doing their part, is not following the treatment plan. This is very common in bipolar disorder. One of the two main reasons is, first of all, people miss especially their manias. People miss their moods and things like the productivity, creativity, and the high they get from them. And they will stop taking their medications and then stop seeing their doctors because they don't want to talk about not taking their medications. Another reason is if their mood gets off, they may think that their medication or their doctor or therapist is somehow going to harm them or is trying to harm them. Side effects used to be the main reason people were non-compliant, when like Thorazine was all you had. We have such a vast variety of medications now for people to try. And so if one is giving bad side effects, tell your doctor you can move on to another and give that a try. But there are some people that are just like side effect prone, and I had a really hard time finding a combination. But so hopefully that's not going to be a term that's going to be attached to you, because people, doctors, psychiatrists, and nurses and that just see that next to your name and associated with your name, and it's very frustrating for them and family. Okay. Dual diagnosis term. This is a term generally used when referring to a psychiatric disorder, more specifically the mood disorders. When someone has a diagnosis of that and they're also diagnosed with a substance abuse problem. That's generally what that is referring to, dual diagnosis. Mood disorder with a substance abuse problem. And substance abuse is huge with bipolar disorder. Either to quiet the mania or lift the depression, or spur a mania on purpose because it feels good, or try to imitate a mania with like cocaine or something, but it will never you cannot imitate the euphoria of mania with a drug like that. And a coexisting or comorbid condition is usually when they're referring more to another psychiatric disorder, if you have more than one. Like I have bipolar 1 disorder, but I also have social anxiety disorder. So that, my psychiatrist would say, that is this social anxiety disorder is a coexisting disorder to my bipolar disorder. Well, look at this. We're done with terminology. So, after this, I'm going to look at my notes and decide what of these things I want to get into next. I think I might do my own story now that we have the terms down.